Next, I want to talk about the glitazones, the TCDs. They're abbreviated TCDs. It stands for Thiazolidinediones, so quite a mouthful. They all end in glitazone. So you have the Z in there, glitazone, the glue for glucose, some drugs affecting glucose. The famous ones, there's 2-rosy glitazone and glitazone. So let's talk about them, how they act. We already said it's kind of downstream insulin signaling what converges with their mechanism of action. They are actually affecting a nuclear receptor, so they are PPAR gamma agonists and affecting gene transcription, do a lot of different things. For example, also are gonna decrease glucose production in the liver, inhibiting gluconeogenesis, have also some effects on lipid profile. Skeletal muscle and adipose tissue are going to lead to increased expression of GLUT4, this transport that takes up glucose. So we're going to store the glucose away, and that helps us lower glucose. As with all of the diabetes drugs, we want to ask the questions, how is their therapeutic efficacy as it relates to A1C, lowering capacity? So A1C is going to be lowered about 1% to 1.5%, which means they are moderate efficacious. Moderate efficacy. What about hypoglycemia? No hypoglycemia. They don't do anything independent of glucose, so this is not going to be a big problem with these drugs. They lead to weight gain, so we always also want to understand what happens to weight. And this has to do with that they are going to increase sodium and water retention with the mechanisms I'm going to mention in a second for the adverse effects. But because we're going to retain fluid, this may explain the weight gain that is seen with these agents. Let's talk next about the adverse effects of glitazones. So there's actually quite a lot going on for adverse effects. So they're pretty hepatotoxic. So let's draw in here a little liver. And so you should check do some liver function tests before you put a patient on glitazones. Then they lead to sodium water retention, has something to do with PPAR gamma receptor activation, leading to increased expression of ENaC in the collecting duct. And obviously this leads to edema. And that's probably what causes a weight gain. Also, you can imagine if you're thinking about contraindications, CI for contraindications, we may need to be very careful when we have a patient with heart failure, because we don't want to cause edema. Then there are also some other adverse effects where I don't have a mechanism behind them, like there is an increased risk of bone fractures. There's also an increased bladder cancer risk. So we should add to our contraindications, obviously, if someone has bladder cancer, you would not put them on this drug.